if I'm ever asked the question, more often than not, is, well, what is causing my diabetes? What could it be? Could it be genetics? Could it be my diet? Give me the special diet. Maybe it's exercise. Or, hey, maybe it's just, it was designed to be that way. Or maybe when I ate something in college many years ago, it was what did it. Or, I think maybe my diet is off or something is off. Well, let me get down to the real root of what causes diabetes, because I know this is a common topic. And type 2 diabetes, there's so much information out there. There's so much data out there about what to do, so many different diets. So in this video, I'm going to actually show you what causes diabetes. I've helped thousands of diabetics become no longer diabetic, so there's got to be something to it. So in this video, a lot of information. Hang on, I'm going to share my screen and we're going to get into it so you really have a good understanding of what causes diabetes, why diabetes is a major issue, and also why most people don't get better as being a type 2 diabetic. All right, so here we go. Hang on. Okay, so we look at diabetes. Well, what exactly causes diabetes? Well, the first thing we look at is, well, what is diabetes? So diabetes, believe it or not, is actually a symptom, right? When a person becomes a type 2 diabetic, well, what we're really seeing is we're seeing that the blood sugar levels are going up and the body can't sustain it at a normal level. Obviously, there is a thing out there called pre-diabetes, which, as I don't necessarily agree with if you've seen any of my videos, right? Well, we don't want to get into that in this video, but we have to understand more about diabetes. So the first thing we look at is glucose levels. So glucose should be between 85 and 99. Now, ideally, right, if it's in that range and your A1C is under 5.7, you're not a diabetic. Your body is functioning well, things are going really well. However, when it actually goes higher than 126 for your blood sugar and your A1C goes over 65, that's actually telling us, hey, something is wrong. Now they label you as a type 2 diabetic, and typically this is where the medications start. The metformin, glipizide, glyburide, Januvia, Genumet. When I first started, there was like 10 medications. Now there's like 60, right? So quite a bit more medication. But the question is also, well, let's understand more about diabetes. Are there different types of diabetics? Well, the answer is absolutely. Let's go through each one. The first one we look at is type 1, which used to be called juvenile onset, right? That was like a phrase back in the day, but it's actually an autoimmune condition. This is where the body attacks the pancreas, or it could be something genetic predisposition, right? The baby was born, the pancreas didn't come out the correct way, and it doesn't function the right way, and that's type 1. There's something called a 1.5. This is where usually you'll see two different mechanisms together. You see the autoimmune component in the body, and then you also see the metabolic component. And in my opinion, and doing this thousands of times, these are the toughest cases, because it's not like we're just going after a metabolic disease. We're also going after, and trying to get the body back to balance on autoimmune. Many of you know I'm autoimmune myself, so I'm very, very familiar with this topic. The next one, which is the most common, is type 2 diabetes. Type 2 diabetes is the metabolic system being broken. This is where you have insulin resistance. The body is just not functioning the way it should be. And it's obviously really important that you have that balanced out. And then the next one is neurodegenerative. So this is where they're linking being a diabetic or having blood sugar problems into the neurological disorders, right? Your Alzheimer's, your dementia, your things like that have been linked to a blood sugar problem, right? That's what the research is suggesting, right? So you got to take diabetes obviously real serious, because no one wants any of these major complications outside the ones we know about, the heart attack and the stroke, and as well as amputations, God forbid. So anyway, let's talk about, well, what causes diabetes? Simply put, it's actually the body out of balance. So if someone was like, well, what's the one thing that diabetics basically share in common as a type 2 diabetic, is that something is out of balance, right? The body, in my opinion, is born to heal. You have that ability to heal. But if something's out of balance, it makes it really hard, if not impossible, to actually heal. So the thing that's tricky is that there's no one size fits all. And the reason for that is because each person is an individual, is different, okay? Meaning that there's some people that they're diabetic for one reason, and then another person who may be related to them is diabetic for a completely different reason. So we got to really look at the bigger picture. So when we look at your diabetes, it's really kind of like an iceberg. Now, the way you understand an iceberg is you could see the top of an iceberg, right? If you're there with a boat, you could drive by the iceberg or whatever, boat by the iceberg, and you could see that there's this big, huge iceberg sticking out. And then if you had scuba gear or a submarine and you went under the iceberg, you would see it's a lot larger than the top. So when most people are aware of what's on the top of the iceberg, right? They see their diabetes, right? They know that they have blood pressure issues. Sometimes they see that they have weight struggles. Maybe also they have lower energy, maybe even neuropathy, and they're starting to get complications. And this is what usually sits on top of diabetes. So what happens is people go to their doctor for these things. Diabetes, they take a medication. Blood pressure, same thing. The weight struggles, they try the gym, they try the diet. Low energy, they try caffeine, stimulants, whatever. Neuropathy, there's different things out there. But this is just the surface, right? Including other complications such as heart attack. Now, you could go and treat the surface, right? Put Band-Aids on each of these things. And honestly, I don't think that really gets anywhere because that's not even the problem. The problem is the bottom of the iceberg. And this is what I found after running really, really comprehensive labs on patients of what's really going on. Well, number one, you could have an infection. It's not uncommon in my office that I'll run a special test and I will see that a person is riddled with infections. Now, let me tell you, if you have infections in your body, it is really hard, depending on what it is, to do a few things. One is lose weight. Number two is regulate blood sugar levels, because if you eat the wrong food, you're going to be feeding these critters that are in your body, right? These infections. It's also really hard to lose weight and get the metabolism going. And then also sometimes when the biome in the gut isn't good, you also have cravings. Your body is like ridiculously craving things that you know you shouldn't be eating. So that's one thing. The next thing we look at is how the body functions with stress. So we have these adrenal glands that sometimes go out of balance, and there are 8 different ways that the adrenal glands go out of balance. Really, really important because you want to identify if your body can't handle stress. So if you get stressed out, does your blood sugar levels go up? Does it actually cause an issue there? We look at mold toxicity. Some people live in an area where there's mold or they've had exposure to mold, and those spores stay in the body. We look at the liver being a major quarterback to the actual physiology of the body. There's no way you can reverse diabetes and get your body in order if your liver is not functioning correctly. Like, it is so vital to be able to function correctly. If your liver or if your liver is not working, you need to have that liver working in order to be well. Now, I've done this tens of thousands of times. I've never seen a proper functioning liver in a type 2 diabetic. Now, let me explain what I mean. I'm not saying that the liver is full-blown disease. I'm saying it's just not functioning well. So an analogy is like a tire. You want the tire in your car fully inflated. You want the air to be exactly where it should be so the car drives better and everything works good. But what if it was partially deflated? Well, it wouldn't be working correctly, and obviously that would create a problem. So that's exactly my point. My point is, yeah, maybe your liver isn't fully deflated, but it doesn't mean it is fully where it should be. And obviously that could affect your ability to get yourself well. The next thing we look at is toxins. There's toxins all over the body, and we live in a very toxic world, right? We live in a world where there's a lot of things in our water, our air supply. It's just bombarded with all different types of toxins. So this is also really, really important to make sure that, you know, your body doesn't get exposure to these things. The next thing we look at is your thyroid. Now, there are 11 different tests with thyroid. The thyroid needs to be functioning well, and it needs to be within the ranges that are actually functional. When you look at thyroid ranges in labs, those are not the healthy ranges. Those are just average ranges. You really need to identify the healthy ranges in order to get that back to balance. I'll tell you this, because I have a thyroid condition myself. It is really hard to get the thyroid working if the liver is not good, because the thyroid hormones convert in the liver. The majority of them do convert in the liver. So if the liver is not well, it's almost like the thyroid really doesn't have a chance to work because they all need to be working together. The next thing we look at is inflammation. Now, most people know that diabetes is an inflammatory disease. What does that mean? That means the body is dying and destroying itself at a rapid rate. Not good. And this is one of the things that probably frustrates me the most after doing this for so many years with so many patients. Diabetes is a known inflammatory disease, but most doctors, insurance companies don't even run the test to look at the inflammation. And I'm like, if you're going to run into a house that's on fire, you should probably know how big the fire is, right? Is it a 5-foot blaze, or is it like a little, like, something little you can use a squirt gun? But as a diabetic, you need to know the inflammation, and you got to get that inflammation improved in order to get better. It's not easy to do, but it's an important step in the process. The next thing we look at is we look at the dysbiosis, the gut ecology, right? The gut is supposed to have a certain number of different microbes in it to make sure you heal correctly and function correctly. And when that goes off, it's really hard to reverse your diabetes and improve your metabolism. The next thing we look at is metabolic blocks. There are metabolic pathways, detox pathways. They all get broken. And I see it mostly in a lot of diabetics where their body just can't even detox the way it should appropriately be done, right? Like it needs to be done the correct way. You look at something called the HPA axis, which is the hypothalamic pituitary adrenal axis. And this is a test that's really important if you're a type 2 diabetic, because this rhythm helps determine like how your brain functions and how your body assimilates itself. And it's so important that system is actually in place. And then we look at hormone imbalances. Hormone imbalances are really important because if your hormones shift out of place, it is like literally next to impossible to get everything back to where it should be. And there's been times where I'll meet somebody and they'll have a child many, many, many years ago. Now that child's an adult, and the hormones will shift out of place and just lock there. And it's really tough because they try to out diet it and out exercise it, but that's not even the reason of what's going on. And with that happening, they get a lot of years of frustration and disappointment with diets and this thing and that thing, because they really didn't get down to the root issues. So when you look at all of this, that could be on the bottom of the iceberg, which is potentially causing diabetes. You got to get to the root of it. And remember, the blood pressure, the weight, the energy, the neuropathy, the heart issues, all of that is the top of the iceberg. It's not really fixing anything, okay? And lastly, we look at autoimmune components. So I also have an autoimmune disease, like I mentioned. That's a really big piece of the picture. So when we look at all of this, we have to go and really understand what's at the root of it. And lastly, I put this big abbreviation in there, not to confuse you, but one of the things that also happens with people who are, especially a 1.5 diabetic, is they have what's called a feed-forward bidirectional vicious cycle that goes on in the body. And that is where both diseases ping-pong across each other. So let me give you an example. I have a couple of labs that I want to show that give you kind of more of a understanding behind it. The first thing we look at is we look at these two inflammatory markers. One is homocysteine, the other one is uric acid. These two markers are really important because these are driving a lot of times the physiology. This is what I was talking to you about with inflammation. As long as these are up, it creates a big issue. This is also something called a circadian rhythm. Now, in the circadian rhythm, you can see this pattern here. That green pathway is actually where your body should be functioning, right? That's where anybody healthy should be. And on this test, you look at doing a test a couple times a day, in the morning, noon, afternoon, and midnight. And it's real important to make sure this rhythm is in place because this affects the brain and also affects your body's ability to have energy, sustain itself. And each of the blue line should actually be in the center of this green pathway. And I'll tell you, if this is out of balance, it is really hard to get the metabolism working correctly to be able to regulate your blood sugar and lose weight. And then I took a lab here, and this is an example of how your body should be functioning. This is a basic biology test and what's going on with your bacteria in your body. Well, the green is good. We like these. These are good. These are going to help your body. But the other ones are not good, and they can create blood sugar issues. They can create known diseases. This is just an example. So it's kind of crazy, right? Is there a solution out there? And I think maybe if you're watching this video, this is the first time you're ever seeing a video I do, you're expecting me to go into like what's the diet and what exercise program should you use. And I'll say there is no special diet and there is no special exercise program. If you have these microbiomes that are an issue, and these bacteria are out of balance, there's no diet for that. You understand? Like, you're not going to eat celery and get yourself better. you have to take a different approach, right? And the approach that I take is in functional medicine, where I go and I work on the bottom of the iceberg. So the top arrow you'll see, that's the one that your doctor's working on. That's the one that you're trying to Google and figure out. And this is the one you're trying to like diet through. But really, the only way to really get better is by figuring out exactly what is going on underneath your case, right? What's on the bottom of your iceberg? What's the root of it? Is it mold? Is it inflammation? Is it the adrenal glands? Is it the liver, the thyroid? Is it infection, toxins, HPA axis, autoimmune, like that's where you got to do the work to figure it out. And you probably figured it out. There's a lot more than just like eating better. Okay. So anyway, let's talk about a plan of attack. So the best plan of attack is one that's going to work. Now, people that live in Florida, obviously I see them on a regular basis and I handhold them in the process. Now you may be watching this from a state outside of Florida and you're like, I want help, and you're not moving to Florida anytime soon, right? So, so let me talk about a simple plan that you could follow that addresses, at least get you in the right direction, addresses a lot of this, okay? So the first thing we look at, right, is we got to address the inflammation. So I put a program together, it's called a metabolic reboot. It is awesome. I do it every year. Sometimes I even do it twice a year. And what it does is it's awesome for getting inflammation down, okay, which is really awesome to do, right? Because inflammation drives all of this. It's like your body's on fire, but it also handles the liver. Now, remember I told you about how important the liver is. So I need, because I have a thyroid condition, I need my liver to be optimized at all times, right? So I do this cleanse once a year, and I call it a cleanse. It's not really a cleanse. It's really a reboot. And it's so awesome because it gets the organs working, gets inflammation down. And this year I did it twice, 2 times. And that is because literally I felt so good on it. All right. So that's the first thing to do. The second thing is you want to balance your diet with a simple 21 days. So you want to avoid getting the toxins in the body because that obviously creates a lot of issues. So by keeping the toxins out while you're detoxing, getting the liver functioning, it just makes things go a lot easier. And you're also going to see long-term results because of that. We then reintroduce foods. There are 5 foods we stay away from during the 21 days. And then after that, we start reintroducing these 5 foods. And these 5 foods tend to be inflammatory. And we want to stay away from it because we just want to let the body have that room to heal, right? Sometimes you just need that space in your body to be able to actually heal itself, where you're not bombarding it constantly. So there's a special way to actually reintroduce these foods in. And when it's done correctly, you could also see if your body reacts to a food, which you may not be aware of. But it's really important because it helps get the foods in a very safe way. So you're not just setting back all of the work and the hard work you've done from the beginning, okay? The next thing is I would definitely recommend running very, very thorough labs with a functional medicine doctor. So whatever state you're in or whatever location you're in, you want to find somebody who really knows how to assimilate and look at labs. If you're in Florida or you have a house in Florida and you would like me to look at labs, not a problem. But anyway, if you're out of state, you want to go look for a really good functional medicine doc who knows what to do. Okay, so that's going to be really the next step. But I wouldn't do that until you start working on the inflammation, the liver, getting all of that worked out, then get labs done. Because if you do labs without doing the other steps, you're kind of going to be seeing a lot of issues that may have been an easier fix earlier on. And then lastly, you want to work with your doctor to help lessen medication. So in my office, the way it typically works is I handhold somebody after, I put them through different protocols on how to reverse their diabetes. And once their blood sugar levels start really improving, I send them back to their doctor, the ones that prescribe the medication, and their doctor makes the decision on what they see in the labs and what they should make, be done. So it's not uncommon for diabetics to be off all their diabetic meds, including insulin and metformin, blood pressure pills, and cholesterol pills, right? But it's as the body proves to the doctor and as the body's healthy enough to be able to do that. But you want to work with your doctor to be able to do that. Now, you'll find out, well, at least for myself, I don't treat diabetes. I treat the bottom of the iceberg, right? I work on those things. But your doctor and your nurse practitioner, whoever's there, they're the person that's obviously going to work with you. So anyway, there is no better time to start than now. So I do recommend starting as soon as you can, getting on your journey of getting better. So if you like more information about anything I mentioned about the metabolic reboot or the 21-day program and things of that nature, what you could do is you could just email us at support@drjspages.com. Okay. And if you put in there help, we'll kind of know what you're looking for. And then my team will take over from there and try to help you in the process. We go into, well, how do we reverse type 2 diabetes, or how do you get better from diabetes? This is the start. This is the start that every one of my patients takes. And it's exciting because I remember like the first day that someone starts on their care plan, it's like, oh my gosh, now they're even getting better and better as time goes on. So start the journey today. If you need any help, just email us. All right. But have a great day. And I wish you nothing but the best. All right. Take care.